Welcome to the Kaleidoscope, Healthcare in a Diverse America, from Molecule to Market, with your host, Sheila Thorne. Each episode highlights leaders and patients of color to discuss culturally, linguistically appropriate strategies and services. You can find this show on all the major platforms, including YouTube, LinkedIn, Apple Podcast, Spotify, and on our website, SheilaThorne.com. Now here's the host of the Kaleidoscope, Sheila Thorne.
Welcome to the Kaleidoscope. Our episode today is to celebrate our Asian Pacific Islander brothers and sisters, including our native Hawaiians. I am Sheila Thorne, and it is my honor to be with you to share this wonderful conversation we're going to have about cultures that you may not be as familiar with as you are others. And we definitely want to consider Native Hawaiians in that mix in the month of May. But why May? We chose the month of May was chosen to commemorate the immigration of the first Japanese on May 7th, 1843. And it also recognizes the completion of the Transcontinental Railroad, which was completed on May 10th in 1869. And that was built with significant contributions from Chinese workers. It's a month to pause and commemorate the contributions of Asian Americans and Pacific Islanders and Native Hawaiians to the U.S. culture and history. The month was designated in the late 1970s, but it took over 10 years to make it a month-long celebration, as well it should be. The term Asian American was invented in the 1960s. As of 2023, there are approximately 25 million Asians in America, 7% of the U.S. population. The largest groups are in California, New York, and New Jersey. New Jersey has one of the highest concentrations of Asians, and California as well. Hawaii is the only state where Asians are the majority population. But when you think of the Asian community, there are 6 countries of origin which account for 86% of the U.S. Asian population. The largest group is Chinese. I've had the privilege in my career of working with the Chinese Medical Association, an amazing and extraordinary group of clinicians. We have the Indian community, which we'll talk about a lot today. Filipinos. I did a cultural competency workshop for extraordinary Filipino nurses in New Jersey who were servicing Black and Hispanic women who were diabetic and hypertensive. Vietnamese, Korean community. I used to live in Englewood, New Jersey, where there's a large Korean community and a wonderful Korean community center, where I've had the pleasure of meeting with some local officials, as well as enjoying some culture and food with the Korean community there. Of course, the Japanese, but there are about 30 to 40 other Asian original groups. Cambodian, Pakistani, Hmong. I worked in Minnesota, Minneapolis, with the Hmong community. Fascinating culture. Thai, Indonesian, Taiwan, and many others. But with all of this diversity, language, history, food, arts, religion, physical appearance, all of these have shared histories, 30 to 40 Asian segments. So if your company is interested in reaching out to these groups, you must be specific about which group you want to target, and it will be a joyful experience and a labor of purpose and love. We're going to talk with my special guest, who is from South Asia, and she calls herself a proud South Asian woman. The countries of South Asia are India, Pakistan, Sri Lanka, Nepal, and Bangladesh. However, we'll get more specific about what my guest calls herself with regard to her race and ethnicity. At this time, I would like you, and it is my honor to present our guest for our conversation today, Ms. Uma Rana. Please welcome her.
Hi, everyone.
Hello, Uma. How are you?
I'm good. How are you? So nice to see you.
Always wonderful to see you, Uma, and thank you for sharing with us your culture and your experience in a fascinating culture that you're from. Let me tell you a little bit about Uma before we really get into the conversation. Uma serves as the Chief of Strategic Partnerships at Gryt Health, a company we'll talk a little bit more about later on. She's leading the way and has led the way in her 25 years of career in the patient voice. Her experience crosses healthcare, pharmaceutical, technology, and patient advocacy. You only have to talk to Uma for a couple of moments, and you know she's passionate about advancing patient-centered innovation, strategic collaborations, and inclusive engagement initiatives across healthcare and clinical research. She's had leadership positions at Bristol Myers Squibb and Accenture, leading large-scale initiatives in strategy and patient advocacy, and advocates meaningful dialogues within the Asian American community. So it is my honor and my privilege to have Uma share with us her journey, her life work in the Asian community, the South Asian community. So with that, Uma, why don't we jump into the conversation? And before we talk about professionalism, let's learn a little bit about you. How is it that you and your family came to the United States?
Well, thank you so much for having me, first of all. So I came to this country when I was 13 years old. My grandfather had moved from Africa to America, and he wanted better opportunity in life for his daughters and grandkids. So every time my grandfather would visit us in India, he would brainwash my mom. You have to come to America. Your kids will learn better. They'll have better opportunities. They'll have better education. So you have to come. You have to come. He kept on brainwashing her. And at some point, my mom decided, okay, we're all going to move together. So all four of us, my parents, my brother and I, moved here when I was 13 years old.
Wow.
Yeah.
Well, let me ask you this.
Yeah.
How do you refer to yourself, Uma? I mean, you hear Asian Indian, you hear East Indian, you hear Indian, South Asian. How do you refer to yourself in terms of your ethnicity?
In terms of my ethnicity, I would prefer Indian.
Okay.
We can also go down and say East Indian, but for now, Indian is better.
Yes, yes. Many people in the United States get confused when you say Indian, they think Native American Indians. So that's why they often say Asian Indian or East Indian. And I've learned that about 40% of people from India prefer Indian, as you suggested. So there's a mixed bag here. If we're wanting to on the community, you really need to understand how to label or how to name these groups. But you came here at 13. That must have been an exciting dynamic. Was it culture shock, or how did your family acculturate?
It was a huge culture shock because we came from such an amazing lifestyle to come here. My parents probably only had $200 to their name. They both had to get jobs, working very, very hard. My father used to work from 7 to 6, and my mom used to work from 9 to 7 in the morning. So we basically, at age 13, we had to just grow up really fast. We had to take care of the household. My brother and I, we both got part-time jobs just to help pitch in. It was a very interesting childhood.
Yes.
I mean, I could tell you that I worked at every single fast food restaurant you can think of. I've had summer jobs. I had jobs when I was, going to high school, 11th grade, 12th grade. I've had jobs throughout college because we needed to make the ends meet. And, it was very difficult. It was definitely a culture shock. I started off my journey being in English as a second language, even though
ESL, yes.
Yeah, even though I learned English in India, English was actually my very first language. Even though I speak Gujarati, which is our region language, but English was I studied in English schools. So when I came here, it was such a shock to me that, oh my God, I have to learn all the grammar and learn how to write. And I was so motivated to be the best student I could be, especially in English, that I started 9th grade in ESL. In 12th grade, I was in AP Honors English.
Well, there you go. Well, fantastic. Well, now let me ask you, what was your life like in India compared to the life that you had to be thrust into when you got to America? Okay, Sarah, did we lose her? Hang on, everybody. We'll get back on. There we go. Okay, we're back. Hey, Uma. Tell us, what was your life like in India compared to your life when you came to America? Was there a big difference?
Huge difference. My life in India was, my father had a great job. We had servants who attended to us hand and foot. I lived in a really beautiful home. So it was basically, I didn't have to worry about anything. But when we came here, we had to just basically start our life all over. We all had to work hard. I hardly saw my parents because they were both so busy working that you couldn't rely on them to, prepare meals for you. So I grew up really fast. I had to take control of the household. I had to make sure that when my parents come home from work that they had food to eat. So basically you just, the way the lifestyle was here, it was filled with a lot of struggles and a lot of hard work.
Yes.
But I don't regret anything because I really appreciated all that upbringing for me to get here where I am today.
That's wonderful. I can just imagine this is a story that many immigrants may share, coming from their home country into a new country, a new language, new culture, new customs. And your father, he was an engineer. He was an engineer, did that kind of work. Yes. And what did your mom do?
My mom worked. She had a labor job because my mom did not graduate college. She only did 1 year of college, and then she had my brother. So she never went back to school, but my dad was a civil engineer, and he worked on New Jersey Turnpike. So what that meant is that wherever his project was, in fact, every time I drive by New Jersey Turnpike has 6 lanes on one side and 6 lanes on the other side. And that was my father's project probably 30-something years ago. So wherever his project were, we would have to live in 20-mile radius of wherever his project were based.
Amazing.
And so I ended up also moving schools 2 or 3 times. So every time I made friends, I would move. Every time I got acclimated to a school, I would move.
My goodness. Wow. Fascinating. Well, obviously your family has endured and persevered, and here you are today. And that story is something that can be inspiring to others and certainly set the tone for when people think about immigrants and all that they need to do and adjust to. But let's get to the culture. How would you describe the South Asian culture? What exactly makes it unique, and what's distinctive that we would want our viewers and listeners to know?
Well, Indian culture is very deeply rooted in family. We respect our elders. We respect families. We believe in tradition, right? We celebrate the year. We celebrate different festivals. We're taught to respect our elders. We're taught to not speak against someone. So resilience, I would say. The culture is incredibly diverse. It's shaped by many different languages. For example, if you come from, let's say, like New Delhi, then you would be speaking Hindi as a dialogue versus if you grew up in Gujarat, you'd speak Gujarati. If you're from Tamil Nadu region, you speak Tamil. So there's so many different languages. There's also different religions. India, even though Hinduism is the largest religion, we also have Muslims. We also have Christians. We also have Hindu Christians. There's so many diverse religions. There's also a lot of regional tradition. If you come from this region, you celebrate specific holiday. If you come from this region, you celebrate something else. And it has generations of history. At its core, Indian culture places strong emphasis on community. We love community. We do a lot of community events. We support each other. We believe in education. That is probably something that is so important. We believe in hard work. We believe in hospitality. If you come over to my house, I'm definitely going to ask you, would you like something to eat or drink? And we also believe in maintaining close family connections. It's also a culture that has beautiful balances of tradition and evolution, where there's values and heritage are honored, while the newer generations continue to redefine their identity, success, and the modern life in their own way.
Well, it's no wonder then that you've brought such richness and culture to America with food, the traditions, the holidays. People may have seen on cable television, Bollywood, the dancing and the music and all of the colorful costumes and dress. All of that has brought the richness to this country. And you bring that with you. Even though you're an immigrant, that still remains the center of your work, family and community. That's awesome. And I find that as a common thread with other ethnic groups as well when they come to America. So we're not really a melting pot. We're really a mosaic. We're a cultural mosaic. And that's really what makes it very special here in our country. So family and community are extremely important. But what about gender roles? What about the family structure? Because health is very personal and very local. What can you tell us about South Asians and how they look at family structure?
So family structure, male are usually the dominant figure in the family.
Patriarchal. Yeah.
Yes, very much patriarchal. We're supposed to believe and support our husbands and fathers and the male figures and be the second-class citizen. That was the norm and acceptable in the past. However, the roles are changing. Women are obviously getting more education. They have their careers. So definitely some of that hierarchy is changing in a way, which is what I love to see. But yes, I get approached by a lot of young ladies asking me advice, what should I do? So growing up, I've never received the advice that, hey, get your education, be financially independent, stand on your own 2 feet. Because my mom had limited information. She did the best she could. Yeah. I have a 21-year-old daughter, and I tell her and all of her friends, be financially independent, get your education, stand up on your own 2 feet, because you have no idea what life has in store for you. Anything can change at any time. No one can take away your education. Once you have your education, you can always stand on your 2 feet over and over again. I could do anything. And if you had to repeat your journey all over again, no one can take that away from you.
Yes, so that remains constant.
Yes, and if I can instill that one thing in young ladies, that would be my message, that please get your education, stand on your own 2 feet, be financially independent, and see where life takes you.
Interesting. And you hear a lot about Indian culture with regards to arranged marriages, the caste system. And those are elements of the culture that many don't really understand. And they don't think that works well in our modern generation. How did you manage that?
Great question. So when I did get married, it was important that I find someone who had similar background, who was from the same caste, and someone from the same community. So arranged marriages are a very normal thing in Indian culture. Parents think they know what type of a suitable candidate would be appropriate for you. And in most cases, arranged marriages they want to make sure that you're going into a right family, someone who can take care of you, someone who can support you, someone who is going to treat you well. So there's so many different factors. However, right now, I don't think that a lot of people believe in arranged marriages, because India is also evolving. People do date in India now. People do have live-in relationships. So it's evolving a little bit depending on what region you are. But in the past, it was always, you had to be arranged.
Very strict. Yes.
Very strict. Same caste, same culture, same household equality.
Wow.
Yeah.
And it's different, and you can't go from one caste to the other. There's no changing, and when you're in it, you're in it. Am I correct in that?
That is correct. And in certain social situation, let's say you marry somebody that's not in your caste, or someone that's different religion, it's very normal that the parents or the family will cut ties with you or disown you to a certain degree. So those things also do happen now, but maybe in villages, but most cities, it has evolved.
It has evolved. Interesting dynamic coming to America with that concept of, for sure. Well, Uma, let's get into health, because that's my passion. That's your passion. And this gives us a context when we think about culture and how health is a part of that. What are the beliefs of health in terms of South Asians or people that are Indian? How do they feel about how they get sick, how they treat it, and the healthcare system? What have you found that makes it unique for Indians?
Great question. And healthcare is so personal to South Asians, right? Our health condition, if there's a serious illness like cancer or something else, right? Sometimes the South Asian community is very private about it. They associate being sick or getting a disease like cancer a stigma or sign of weakness. Therefore, they're not very open about it. They don't share their experiences, right? Many families don't open up. They don't talk about diseases. There's not a lot of conversation happens regarding mental health or any other personal health struggles, right? We're often told that if we talk about it, someone is going to judge us, or they may not perceive us in a way that, oh, we're strong or we're this or we're that, like they'll judge us.
Yes.
Yeah. There's often out of fear, or even certain times their cultural expectations or concern about how our family will be perceived, right? At the same time, right, the mindset is slowly changing. As more people I see are advocating and having open conversations around their health, right? Especially prevention and mental well-being. I see this in a lot of the younger generation. They're openly talking about getting therapy or being on any antidepressant drugs, things like that, and seeking support without shame. So I think it's evolving. But yet, yes. But
so anyone that wants to approach or engage the community must be aware of those situations, because you may have the same 3 or 4 generations in the same house. The older ones thinking the old way, and the younger ones, as you say, evolving into a more westernized concept of medicine. So that's important to know. That happens in the Latino community. It happens in the Black community, as well as the Native American. So it seems, again, that's a common thread about fearing health. And you know this because you do so much work in the cancer space. Early diagnosis is the key to success in treatment. So if you have a fear or a stigma, that becomes problematic. And the pharmaceutical industry obviously is a data-driven industry. And yet for the federal public health arena, all that data is aggregated. It doesn't take out Asian Indian from Korean, from Japanese. They put it all together. And they've been for years trying to disaggregate the data so you have real numbers. So that's challenging. So is diabetes, hypercholesterolemia, hypertension, are those prevalent among the Indian community?
Very prevalent. A lot of Indians have diabetes. A lot of Indians have hypertension. A lot of Indians have heart problem. In fact, I was listening to Dr. Sanjay Gupta's podcast yesterday.
Oh, yes.
And he was sharing how he takes metformin, not because he has diabetes, because he comes from a generation of people with severe heart issues, and he wants to live longer. So I feel like as more and more people share their family history, share their struggles and share what they're battling and what supplements they're taking, how they're conquering some of their diseases or even prevention. The more education, the more information is out there, I think it's going to benefit lots and lots of people.
Absolutely.
I was very
probably they're more open with you because you come from them than they would be for others. So putting that messenger, that person who can relate and have a good conversation is important. You know, Uma, I had a CRO call me years ago because they wanted to do a clinical trial on hypercholesterolemia with the Indian community. They speak English, they're fairly affluent, and they thought that was going to be a good target audience. Well, the people at the CRO said, what is an Asian Indian? Is it Asian or is it Indian? They didn't even know. So there's a cultural deficit that we have to fill if we want to approach anyone from the Asian community, because you have to understand the context. And you mentioned something interesting, the religion, Hinduism, Muslim. I mean, their dietary lifestyle is very different as well. Many are vegetarians, are they not?
Yes.
And they don't eat meat. Is that a good or a bad thing with regard to health behavior?
It could be good or bad. I mean, if you're vegetarians, it's very difficult for you to get a lot of protein and some essential amino acids that are strictly in animal products.
That's
However,
right.
there in the past, I mean, we don't eat beef. So in Hinduism, we worship the cow. So I have never eaten beef in my life. I wouldn't even know.
Interesting.
Yeah.
So you're not going to McDonald's and Burger King, are you, Uma? That's not part of your agenda in culinary preferences.
I mean, if I do go to McDonald's, it'd probably be chicken sandwich, but not to on certain days of the week. I'm vegetarian 3 days a week out of the 7 days. But yeah, in Hinduism, you worship the cow. I've never eaten pork. I wouldn't even know what that would taste like. And but now the conversation is also changing a little bit in the Indian community. We are also believing in fitness and eating high protein diet. So there's a lot of buzz on social media, how to be a vegetarian, but include enough plant protein to make sure that you're getting a lot of protein in your diet.
A lot of the nutrients. So that's interesting. And there is a study, the Masala study, that is looking at the Indian community and trying to figure out some of the dynamics that would go for prevention. But obviously things must work for you, because the life expectancy of Indian people is 85, 87 years old compared to Americans, which is much, much less than that. So the lifestyle, although may be restrictive, it apparently does a good thing. But now I was really touched when you talked to me about your life as a caregiver with your father, and how that impacts the work that you do today with Gryt Health regarding patient voice. Tell us a little bit about that and how culture entered into that dynamic as a caregiver.
Yeah, so I lost my dad in 2021. My father had stage 4 neuroendocrine tumor. He also had Thank you. He also had Lewy body dementia. So the combination progressed very fast, and I had to put him on hospice, which was very difficult time for me. There are many cultural challenges when we're interacting with the healthcare system. American healthcare system is, first of all, we have language barriers.
Yes.
We have cultural and religious differences and limited understanding on how to advocate with the healthcare system. So in many South Asian families, we give the physician such high value.
Such reverence,
Yes, consider the doctors. We give them as much importance as God. We don't get second opinion. Whatever they say, we believe. We don't challenge medical decision. Sometimes we don't seek different opinions, because we're like, oh, well, blah, 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 doctor said, so it has to be true. We don't even think twice about it. And personally, my Personally, it became very real for me when my father was misdiagnosed. His x-rays, his MRI reports were read incorrectly. And
Really?
yeah, and I felt that if I didn't get a second opinion, if I didn't keep on asking so many questions, I wouldn't have gotten the extra 5 years with my father.
Oh my goodness! Wow.
Yeah.
Wow.
Yeah. So this
And when he was in hospice, obviously that's a very emotional time for any patient that has to go to that route as well. But what did they offer you in terms of hospice that would help you to endure this?
So they offered care, but they kept on pushing priest.
Really?
We're Hindu, yeah. And they kept on saying, well, it's an Indian priest. The priest is from India. I have 100% respect in them supporting us,
Sure.
but my mom and my dad were extremely uncomfortable. They were not comfortable opening up to even family members. What would a priest do for them? And they didn't understand. They're like, well, it's an Indian priest. And I said, well, they don't want to talk to a priest. So these are some of the cultural and traditional differences that I felt are if they said, well, how about we offer you some Hindu religious leader or somebody from the temple that can come, Hindu temple, that can come and talk to you or offer prayers, that would have had been a different experience because my parents would have been so open to that.
Interesting.
But they felt extremely uncomfortable. They were questioning, why would we want to talk to a priest?
Isn't that something? I mean, certainly that discord, that cultural discord is something that definitely impacts the family at a very emotional time. So I can just imagine how you may have felt about that. And obviously religion and spirituality in many ethnic groups is critically important, whether or not you have an organized religion or just your preference. So the system really was not responsive to your cultural needs at that time.
Not at all. I couldn't find anybody in the entire hospice space aside from the doctor that spoke our language or had any aide who because my dad was also suffering from dementia. And when you have dementia, you kind of revert to your original native mother tongue. So times he would forget English and speak only our dialect. And there was no social worker, no one to kind of help navigate even some of these language barriers. So it was very difficult for my mom to even understand what was going on because the lack of support, the lack of
sensitivity. Yes. You know, there's a wonderful book called The Spirit Catches You and You Fall Down. I'm sure you remember that book about the Hmong family who came to America and one of their children was suffering from epilepsy. And they were not getting the cultural support or understanding or compassion that they needed. Unfortunately, the child did pass away, but it's a great book to show you how cultures can clash within the healthcare system. And if you don't have someone that really understands that, it can be a traumatizing situation for the family. But Uma, that probably affected the work you're doing now, going through that experience. What impact did that experience with your dad and your family in that serious condition have in your work that you're doing today?
It made me more passionate about creating more inclusive healthcare system. I want to make sure we're expanding access, support, resources and education for non-English speaking patients. We want to make sure that we're ensuring these patients come from diverse communities and they feel seen, heard, and empowered.
And that's a challenge as the country, I should say, becomes more diverse. That's something that we talk about. Cultural competency was a huge movement, cultural proficiency, cultural fluency, all of that terminology is now being used, but it's not that easy to implement and execute. So that must be what drew you to Gryt Health, Clearly, Gryt Health has taken the lead in that. Tell us about your work with Gryt Health and what they're doing now that there's been such an upheaval in the healthcare industry. How has that experience been for you?
So at Gryt Health, my focus has been focuses on improving patient education, support, and access across healthcare and clinical research journey. Our work is centered around abilifying the patient voice, building a meaningful partnership, and creating more human-centered approaches to healthcare innovation and clinical trials.
Okay.
So together we've created something called a PACE Council and as we recognize the growing role of AI in healthcare, we need to ensure that it's developed ethically, responsibly, and inclusive. Yes. We want to bring together diverse voices across healthcare, patient advocacy, technology, and industry to help ensure that AI solutions are built with patient at the center, reducing biases, improving representation, and protecting the human experiences within healthcare.
Wow, that's quite a mission and a vision. And I know your leadership. I'm very familiar and privileged to be in conversation frequently with David Craig, who heads up the group, as well as the amazing people on your team and your staff who have really been a leader in making sure the patient voice, the patient journey is front and center. And you're right, Uma, Equity AI is my form of making sure that it's inclusive, equitable, fair, and just, as this technology has come into the industry like a tsunami in terms of what we need. And data is critically important. So you're Indian, as an Indian woman, your experience then must be very critical to the success of this patient journey and patient voice. And how have you seen the industry respond to that conversation? Have they been receptive to it?
It's hard to say. It's 50-50.
It's a mixed bag, right?
It's a mixed bag, 100%. Yeah, I mean, it's such an interesting phenomena, as you know, in pharma. So many companies are facing profound changes.
Yes.
Many of the teams, there are lots of layoffs. The teams are, many of the teams that we work with are learning technology that never existed in human history.
Right.
Yeah,
Yes.
and it's exciting, but it also creates new risks to be managed.
Yes.
For companies, for patients, especially who depend on new medicines.
Yes.
Very
that pipeline, that drug development pipeline and the research, and how representative is the data that comes from clinical research. And that's what I know we've all been very focused on. You can't use the data if it doesn't represent the population who's going to be using the products.
Exactly.
So it's complex. There's no simple solution, but tell me how important it is to have the human intervention in that process.
It's so important, right? And this is why we created PACE Council. So at Gryt Health, where we have this PACE Council, it's to take the leadership role in advancing AI, especially in the patient engagement. So PACE is basically a cross-stakeholder network focused on keeping humanity at the forefront of AI in drug development.
Amen. Amen.
Our PACE members have over 300 years of combined experiences in medicine development. And the best part is we're not only patients, we're survivors, we're caregivers, and we're advocates. So collaboratively, we want to make sure that this is done well, this is done correctly, and that we leave no one behind.
That's exactly right. We have to have as many people at the table as possible. People from South Asia, people from the Caribbean communities, from Africa. You know, I shared with some of your colleagues that I went to South Africa. I went to Cape Town for an international AI summit, and I saw the diversity, language, history, culture, religion, all of that gets into the bucket of when you're trying to figure out the best recommendation, the best product. So it's a dynamic that's hard to keep in focus. Because it is a business. Medicine is a business, and pharmaceutical, biotech, and medical device companies are there, and they've done extraordinary work. There have been major breakthroughs in disease treatment. But the question is everyone benefiting from it? And it seems like that your colleagues at Gryt Health are making sure that that's a part of the equation. It's not easy, is it? It's not easy.
Not easy.
Yes.
And I'm so grateful to work with Dave Craig, who is, if not more passionate about this initiative.
Yes.
So it's very good to work with people who share your vision and share this passion as you do. So yes, I'm extremely grateful. Yeah.
And again, you being at the table, how many other Indian people are at the table? How many in your career have you seen at the table doing the work that you're doing? Enough?
Not enough.
Okay. So
I would love to see more women. I would love to see more representation.
Yes.
I would love to see more diversity. I would love to check off the box that says Indian. And
yes.
Yeah, that would be ideal.
That was exciting that you told me there was no line on the census for Indian.
No line. So there's
Caucasian. What did you check? You check Caucasian, white?
No, I don't check Caucasian. So there's Caucasian, there's Hispanic, there's not Hispanic, and then there's Pacific Islander. So depending on the choices, I always put not Hispanic or sometimes Pacific Islander if they provide description.
Wow.
But there is no Indian, there is no Asian in a sense. There's no differentiation if you're from China, if you're from Japan, if you're from Korea. So yeah.
That's interesting because the federal dollars that are used to service populations are based on those numbers, the census numbers. So if you're not represented, how can those dollars get to those communities? Boy, Uma, we've got a lot of work to do, don't we? I think that the mindset and the systemic institutional biases that are built into the system are what we're always facing and challenge. But it's a challenge, definitely it's the best of times and the worst of times in many ways, but culture and innovation and representation are the terminology we use now, because the other words that we used to use, like diversity and DEI, those are red flags. People kind of shut down when you talk about that, and that's unfortunate. But you're still doing the same work. You just call it something different.
Correct. And I just wanted to share with your audience that if anyone's looking for any additional information, they can connect with us at www.com. Just visit the PACE webpage. And we'll definitely see you there if anyone has any questions or would like any additional information.
Tell me what the website is again. What is it?
It's www.grythealth.com.
And just go to GRYT, Gryt Health.
GRYT, Gryt Health, one word.com. And please visit the PACE, PACE webpage.
And tell our audience, if we want to know more about the Indian community, if you're working in a zip code, a region, or a market where there are large numbers of Asians, and they may be Indian or Pakistani. There's the American Association of Indians, Physicians of Indian Origin. There's the American Association of Pakistani Physicians of North America. There's a Ethnic Minority Nurses Association, which includes ethnic and Asian nurses, which are definitely a large part of the healthcare workforce, as well as pharmacists. Many come from Asian countries. So there's a wealth of experience out there. But what if I want to know more about the Indian community? What do I do?
Yeah, so I would say it starts through curiosity, conversation, and lived experiences. Take the time to learn about history, right? Traditions. Every area has different tradition, languages, food. Try some Indian food. The whole buzz, button and garlic on.
Love Indian food. Love Indian food. And there are 30 Chinatowns throughout the country. A lot of them in California, Los Angeles. During the Chinese New Year, I go down to the New York Chinatown, which is one of the largest in the country. There are Koreatowns. every ethnic group. And in Queens, you go into certain neighborhoods of Queens, you look like you stepped into China or you stepped into Korea. So don't be afraid to experience the culture. Yeah, to celebrate the culture.
Yeah, visit some of the temples. You get to learn so much about how the religion evolved and how there's one main God, but took so many different forms to fight evil.
That's right.
Yeah.
There's an expression, out of many one. And that's what I use when you talk about humanity and you talk about the patient voice and the human voice, so that whatever that you do with regards to healthcare, no matter what you look like, what language you speak, or where you come from, we're all entitled to quality, affordable, culturally competent, and relevant healthcare. And I think we're headed in that direction. There may be some hills and valleys, but the journey continues. Having professionals like yourself sitting at a table, not outside the door, but sitting at the table, not at the margins of innovation, but right in the mix. That's the goal, so that we all can live longer, quality lives, even if we've been diagnosed with horrible, life-threatening diseases. And we all need that experience. So if there's any one thing you want to leave our viewers and listeners with about the Indian culture, what would it be?
I just say be open-minded, be respectful, and just treat us like anyone else, and just respect our culture.
That's right. And celebrate. Yes.
We love celebrating. We love having people come to our community events. We love sharing our culture with everybody. So it just makes us feel good. Again, we're big on hospitality. So our house is your house. So just all share wealth and embrace.
And much of what happens with discrimination and bias is about fear. People are uncomfortable. They haven't had the kind of life experience that is open enough for them to feel that way. But I've always felt welcomed in diverse communities, even though I'm an African-American woman, you're an Indian woman. Basically, you want the same things for your family. You want the same things for yourself.
Same opportunity, same respect. And just seat at the table.
That's right. And this diversity in America, this mosaic, as I call it, definitely lends itself. So there's nothing wrong with the melting pot, but you also have ethnic pride. You also have personal traditions and languages and history that you want to hold dear to yourself, regardless of whether you're of color or not. So again, it's bringing back humanity into the healthcare element. And that will always be necessary because it can be not only essential, but existential. It's life and death. And so we take that very seriously. And your daughter, you told me, is going into public health, huh?
She's going into public health. And I always tell her, it's very important to know where you come from in order to know where you're going.
Absolutely. That's exactly right. My mom was a nurse. My sister was a nurse. And so health was always important in my family, but it may not be in other families. So sharing, reaching out, understanding, and compassion are all part of it. Survivorship is critical. If you are successful in your treatment, if you've been in a clinical trial that's successful, that's where advocates usually come from, who've had that life experience. And I know that's part of your professional journey as well. Well, this has been so enlightening, Uma, and I applaud you. I admire you for your family and their journey, what you've been able to accomplish and contribute to us, and how the richness of your experience inspires us to keep doing what we're doing. And I thank you for your time today. And I hope that I know that this is going to be seen by many people. And I hope that they do reach out and become a part of this movement that I think we've begun. It may have had its ups and downs. It may have had its back steps, but you keep moving forward. And quite frankly, with the nomination or having the first Indian woman as a vice president was certainly opened a lot of people's eyes to the Indian community and a woman. So I think we're making progress, but there's still more work to be done. So thank you, Uma. I wish you well, and I look forward to continuing our fellowship and camaraderie in the journey we're on. You take good care.
Thank you so much. You too. Thank you.
And thank you to all that
You've been tuning into the Kaleidoscope, Healthcare in a Diverse America, from Molecule to Market, with your host, Sheila Thorne. You can find more episodes on all the major platforms, including YouTube, LinkedIn, Apple Podcast, Spotify, and on our website, SheilaThorne.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.